Hello, I would like to introduce you our method how to treat disc herniation without surgery with spiral stabilization method. Our method is developed 40 years ago and my name is Richard Smiszek, medical doctor, and my daughters continue to develop this method. We treat a patient in ambulance and 1 hour therapy, and after that home exercising, another possibility to stay approximately 1 week and to have a therapy 3 times 1 hour every day. We are close to the center of Prague, Czech Republic, and if you decide to know more, then now I would like to talk about Discarnation Therapy without surgery, then trainings therapy with spiral muscle chains. This herniation will disappear approximately in 3 till 12 months. We use full control of mirror of both sides of the gym, and the front view show you your back, then you have full control of your correct coordination. Then training of spiral muscle chains. Spiral muscle chains you can use only in erect position when your pelvis and head is completely straight. If we have muscle balance between front and back part of our shoulder girdle and pelvis girdle, and properly motion to the back, then extension in the shoulder girdle, activate muscle chain between shoulder blades, abdominal wall and gluteus, and after that continue to the foot and create the arch. It is necessary to stretch your back muscle, erectus spine, and your hip flexors, then rectus femoris, iliopsoas. Our training is based on strengthening of spiral muscle chains, relaxation of vertical muscle chains and stretching, and mobilization of the spine in the rotation. But the third one will be later when you have no pain, no paralysis in your muscles, and no problems of feeling in your limbs. Then strengthening of muscle chains, relaxation and mobilization, 3 principles, 3 levels how to treat the back pain and disc herniation. We use the knowledge of dynamic muscle chains, they stabilize the motion, and vertical muscle chains, they stabilize the quiet position. Dynamic muscle chains we activate through shoulder blade motion down, oblique to the lateral abdominal wall. We continue to connect obliquus externus, internus abdominis, oblique muscles, and the power is going down through gluteus maximus to tibialis anterior and create the arch. Vertical system. Squeeze the spine together, overuse the spine, and we should use it only in a sitting position when the spiral system is not working. Then relationship between spiral system and vertical system is like reciprocal inhibition, agonist, antagonist, or active muscles and muscle relaxation. Through exercising on upper limbs or lower limbs, we can activate this muscle spiral chains and create traction of the spine. Then the compressed spine that we have after 8 hours sitting at work, we can open again and regenerate. In sitting position, we create muscle imbalance. In standing, this muscle imbalance start to compress our spine, and the worst is motion walking when the short muscles squeeze the spine, compress the spine, overuse, and we start the degeneration, and later we have disc herniation or spinal stenosis. Then sitting position is the position when we have only muscle imbalance and motion create this degeneration. Then properly motion is based on regeneration of the spine, but we should have nice vertical axis, extension of the upper limbs, shoulder blade move down, and we activate abdominal wall and gluteus maximus. Then properly gait with very nice extension, outer rotation of the hand is possible to use like good regeneration. But before, I recommend to exercise approximately 5 minutes and wake up the activity in abdominal wall muscles through spiral stabilization, because in sitting position we use too much vertical system. Then motion to the back, trapezius and latissimus dorsi activate abdominal wall in the lower part. Upper part, pectoralis serratus, is motion in front. When we are walking, we use both. Right hand to the back, left hand to the front. But the most important for therapy is this lower abdominal wall activation through extension motion to the back. Then full muscle corset is the most important stabilization of our body to be ready to regenerate the disc or treat the disc. Motion to the back, pull the abdominal wall inside, and we raise the disc up. Abdominal wall, raise the disc up. Then muscle spiral system is natural motion that use the motion shoulder blade oblique to the abdominal wall, squeeze the abdominal wall together and create traction of the spine. The vertical system relax in any spiral activity. Then disc herniation need activation of abdominal wall, and in sitting and standing position required, we use vertical system. Motion activate the spiral system when our shoulder blade is going back and down. Vertical system compress the spine, spiral system stretch the spine and increase the nutrition of the disc. The intervertebral disc has oblique fibers in annulus fibrosus, like the oblique muscles in abdominal wall. Then the same direction of oblique muscles, fibers, like annulus fibrosus, tendon fibers in this disc. In the backside, connection latissimus dorsi and gluteus maximus has the same direction like disc connective tissue fibers. There are no fibers going up and down, they are not erector spine and not straight abdominal wall muscles. Now it is possible to see the action of oblique muscles. They create the traction of the spine. And through exercising any motion, increase the diameter of the disc. Then spiral system stabilize lateral abdominal wall, relax the vertical system and create traction and good nutrition of the disc. Then our system, spiral muscle techniques, create muscle corset, stretch the spine upwards and lead to complete resorption of the sequester of the disc. The training of the disc herniation need strengthening of spiral muscle system, relaxation of the vertical system, and mobilization, but mobilization is the last one after relieve the pain and paralysis of the muscles. Sitting position is very good if it's not painful to start the exercising program, and this exercising program create the power up, and we raise the body up, our disc up, and we improve the nutrition of the disc. Then spiral system activation, move the abdominal wall inside, relax erector spine and psoas major. Some samples, then iliopsoas, squeeze the spine together, compress the spine and disturb the nutrition of this disc. The normal disc has a white color, there is nutrition inside, then fluids inside. This is like a lemon without some juice. This is the black disc troubles, then without nutrition, degeneration and disc herniation continue in this degeneration. Here is full resorption of this disc herniation and spinal channel is completely free. Here is very big disc herniation, spinal stenosis, completely resorption of this disc herniation. This is this very big disc herniation, this is completely resolved. Then activation between shoulder blades, abdominal wall, gluteus is the most important principle of spiral stabilization. And if we stabilize the body, we continue to stretch iliopsoas, rectus, femoris, these hip flexors, they squeeze the spine in any step when we have zero extension. This extension is approximately 10 centimeters. That's enough for walking. Next, the herniation is again closing the spinal channel, and the spinal channel is now free. This herniation and full resorption of the disc herniation. Exercising again, shoulder blades, abdominal wall and gluteus, stretching of psoas rectus femoris and gait coordination. Then we should gait stabilize with the spiral system too. Then we need extension approximately 10-15 centimeters to be possible to walk without compression of the spine. Next picture shows again disc herniation that was resolved after the exercising program, and this disc had a surgery. That was the first wrong therapy, because after this disc surgery we overuse another disc. Then this surgery was done without rehabilitation, and when we do not relax psoas erector spine, we should create only new degeneration, and here is spiral stabilization training. It was necessary to use for the first herniation too. Then this herniation disappear, and the exercising program shows then first we start with zero extension, then risk of spine degeneration is very high. We relax this muscle tightness in front of the thigh, and next picture shows even better relaxing. Spinal degeneration, spinal stenosis is complete, and again we have a good result. Here's spondylosis, spondyloarthrosis, then degeneration of disc of the vertebral body and the joints. Again, good result, patient is without any pain. This is very big, this herniation, and this herniation need approximately 1 year to be fully resolved, but the patient was without pain in 1 month. Then this full resorption and this big disc herniation could be treated without surgery too. And this sequester that is deep in the sacral bone level of spinal channel, it is possible to again resolve. This is nice free space for the disc and of the nerve root, and the nerve root was here inside of the sequester. Spinal channel is open, that was pulled to the side. Then again spiral system of exercising. Next disc herniation again is reduced, and this hyperintensive zone, this risk of next disc herniation is treated too. The nerve root is free after therapy, before was inside of this sequester. Then free nerve root after therapy. Reason of this disc herniation was too much sit-ups without any regeneration, then typical wrong exercising program in the fitness center. Then please, if you don't want to have this herniation, stop this sit-ups and use the spiral stabilization abdominal wall therapy or training. Now this lady changed the fitness program. Very big disc herniation again good result of the spiral stabilization therapy. Once more another level, and in the transversal cut we again good results. Another disc herniation will disappear, and in sacral bone the sequester is again resorbed. This man had a problem 18 years without any properly therapy, and after 18 years it is possible to treat him. Then it is possible not only in the acute phase but in the chronic patients. Then 18 years without any properly therapy, that's the problem. Then I would like to solve with you and give you the information. Exists a properly causal therapy. Typical computer disease. Then specialist for computer, sitting position all the day. Another picture shows then this protrusion of the disc will develop disc herniation later, and the therapy that was there done was not enough effective. Our therapy that started here completely resolved this disc. The herniation and this sequester is completely resolved. Then disc herniation resolved. Protrusion, another wrong developing disc herniation, and completely therapy. Another disc herniation back and to the side, dorsolateral. Again, good result. And again our program. Another disc herniation to the back side of the spinal channel and improvement. Patient is pain-free, and this transversal picture we see very good resorption of the disc herniation. Another disc herniation with good result, but this white tissue in the vertebral body is modic. That's edema in the vertebral body, and we should continue with this regeneration all the life, because when we stop this exercising, the compression of the spine. There develop this growing up vertebral body, then spondylosis, and this growing to the backside will compress again our nerve roots. Then spinal stenosis should be done because the bones are swallowed. Again, good result of this discarnation therapy. I recommend to have a good X-ray examination in standing position because the spine is now full loaded and the two vertebral bodies are together, and in the magnetic resonance there is a space, but it is in lying position where there is no pressure. Then X-ray, MRI together. Again, exercising in spiral system, and another this herniation slowly disappear, then is smaller and smaller, and this man is attending fitness center, and use a lot of weights and fitness machines, and they disturb this spiral system of motion. Then we need to relax his erector spine, his psoas, and create good spiral stabilization. And the fitness program on fitness machines is not recommended from our clinic. We can here nice stretch the spine on the sling system, and we continue to stretch, and after the stretching a little bit open the spine on the back side. Then this is beginning of our therapy, when we use it approximately 3 times during the day, 3 days. Usually patient is pain-free. Then manual therapy, but only traction, no rotation, no lateral flexion, is very effective. Starting of therapy of this herniation. After that we stabilize and stretch the hip flexors and pectoralis muscles that were short from fitness wrong program. Correction of the exercising is very important. Next one is again with good results, and this herniation is improved. This lady is sitting too much in the office, and the spine is overused from sitting position. Then again walking program, then coordination of the gait. Another disc herniation, and disc herniation again has a good effect. Then in sacral bone again good resorption, nerve root is now free. Then once more strengthening, relaxation, stretching and mobilizing together with traction of the spine. This exercise stabilizes, and the stretching is only very small. Now we increase the stretching, maybe 1 week, 14 days later. Stabilization is again there. We stretch the hip flexors, wait maybe 14 days after the acute phase, and 1 month later we can start this small rotation therapy, and together with the traction and spiral stabilization. Gait coordination maybe 2 months later. Then, if you like to have good diagnosis, start the therapy, please have an X-ray in standing position. When we see the shape of the spine, the position of the vertebral body, the space between vertebral body and space for the disc. Here it is very narrow. We need MRI to know exactly where is your disc herniation, right, left, foramen, And after that we can start your therapy on exactly space where is your troubles. We need to help you to have a good coordination. And it is better to start with some good therapist or trainer and be controlled in the position and range of motion. The list of these therapists you will find in our homepage, stabilization.com. You will find them in Czech Republic, Slovakia, Germany, England, Finland and Sweden, and in Korea too. We have books for patient, simple book for starting to therapy, 11 exercise, 50 exercise you will find in this book, Healthy Spine, manual techniques and correction of the spine, stabilization training, it is muscle chains, there is an anatomy of muscle chains, but very large anatomy, 2000 pictures you will find in muscle chains DVD, and manual therapy techniques with video are over there. Scoliosis therapy is another part of our program, and we use this program for a sportsman, football or another sport. We use this elastic cords, they have 4 powers. One is only a very small one, black elongation we use to 1 kilogram resistance, green one 2 kilograms, green without elongation 5, and 2 elastic cords together we can use for 10. Then if you use this elastic cords you have 4 possibility to change the power. Then I hope I could explain you how to treat this herniation. We have treated 20,000 patients in the last 20 years, me and my colleagues. We have approximately 20,000 therapists and trainers in Czech Republic and European countries. And if you like to attend our courses, you will be very welcome. And for the patient, we have therapy program, and we sure recommend your therapy in your country if you are good trainer or therapist. Then thank you very much for your attention, and see you maybe once in the world.